Hey everybody, welcome back to another Migraine Mentors minicast with your hosts, the Migraine Mentors. My name is Dr. Eric Reese, and I'm here with Dr. Thompson Maisaka. Dr. Maisaka, say a little something into the camera.
Great day to be alive, man. It is a great day to be alive. I'm just having a great day today. How are you?
It is a good day. I can't complain. I can't complain, and even if I wanted to, as my grandfather said, nobody would want to hear it. So, and complaining doesn't really do much, anyways, as most of us probably have found out. But one thing we are excited to talk to you about today is something that has become a bit more of a topic for us over the last week or so with some of the patients that we've been seeing, which specifically points to the conversation about medications and managing migraine symptoms. Now, for those of you who are listening, who have been listening for a while or who follow our newsletter, we've written about medications causing different types of nutrient deficiencies, different metabolic processes, stuff like that, that may not be beneficial for healing. But this is a bit of a different conversation today, really just honing in on the fact that sometimes taking medication for migraine can actually make those things worse. So, Thompson, you and I were talking just before this. You have a bit of a story about a patient that you were describing to me earlier. Can you just maybe share that with the rest of the team?
Yeah, it was what appeared at first to be a pretty straightforward migraine case. Her biggest symptoms were dizziness. So she'd have an attack and she would feel like she just got off the most intense roller coaster of her life. And she did not take you very long, even if you're not trained in it, to see something was wrong. She would wobble and she was moving very slowly and she would hold on to the walls as she would walk, obviously very off balance when she was having these attacks. And so we started the rehab process. There was a lot of stuff to work from. And so we kind of hit this wall pretty quickly where the rehab was objectively working, the tests were getting better, but she was not doing well at all. She was having these major attacks in between appointments, and it just didn't really line up. So we started asking questions and we looked into the side effects of her medications. And she was on 2 migraine medications and an anxiety medication, all of which had dizziness as a side effect. So we looked into it and she talked to her doctor. She said this is a pretty common thing that people see. So they started to wean her off them, either reduce the dose or transitioned her off to a new medication. And she came back and we rehabbed, and it did what we thought it was supposed to do. There really wasn't all that much to rehab once the medications were out of her system anyway. That was just a really powerful lesson in check the side effects, because sometimes it's hard to distinguish if it's a medication side effect or if it's an area of the brain that fails during the attack, or if it's a nutrient deficiency. That's kind of the shell game that we play as practitioners, is trying to figure out what the source of these symptoms are. And in this case, it was pretty cut and dry medication side effects. So that was definitely a lesson that you only have to learn once.
Was that surprising for you? Like, was that something that you were taken back by, or is that something where you're like, gosh, this happens more often than we've been led to believe?
That was pretty early on in my career. It was a few years back, more than a few now. But it was at first a little bit concerning. It was sort of, the veil was lifted because you start to look up all these side effects. And that was really the moment when it was like, you gave someone with migraine, which, head pain is a huge part of, and the side effect is headaches. Like, how does that make sense? Help me make sense of that. And that sort of sent me down the rabbit hole of, oh, okay, it's actually really common and no one talks about it. So let's talk about it.
Yeah, fair. Yeah, it's interesting too, because as much as we want to talk about medications having that, like, even some really basic over-the-counter medications can cause outcomes of nutrient deficiencies. So one of the articles we wrote early on with our newsletter was just talking about like aspirin. Aspirin's such a basic, COX-2 inhibitor, anti-inflammatory. You can take it like candy kind of thing, and you can get it anywhere you want to. But we found some research and studies indicating that aspirin could actually cause some vitamin C deficiencies, which could impair your immune function. There's other aspects with just basic metabolic processing that can be affected with that. And so there's always transitions and trade-offs, right? So even in like the supplement world, where we live probably more than others because we can't prescribe medications, we can't take people off prescription medications without the help of their provider. Even in the supplement world, right? There are things that you shouldn't be doing. So for instance, like when you take a look at like depression, a lot of people will try and use things like St. John's wort. Well, it's kind of contraindicated when you're taking an SSRI, because you can do things and produce way too much serotonin and cause serotonin syndrome, right? So even supplements are not like immune to this aspect. And so you really do have to be careful on both sides of the aisle about doing your research, understanding the patient in front of you, and then more importantly, asking those questions that maybe you overlooked in the beginning. So with that said, curious for just your clinical take on this, because I'm sure there are people wondering, like, what specific medications should they be looking out for, or what common medications that are properly prescribed for people with migraine or migraine type syndromes should they be looking out for, maybe having some common side effects that maybe haven't been described to them.
Yeah, I mean, the big ones that we see a lot of, the triptans and the CGRP medications, even some of the injections have come with a pretty hefty list of side effects. I think the best thing to do is write down your symptoms and then look up your medication and see if those are known side effects of that medication. And then you can have a discussion about, is the juice worth the squeeze, right? Like, is this even affecting my migraine frequency enough to justify those other side effects? And then if the answer is no, then that would be a good conversation to have with your prescribing physician. Again, we're not anti-medication, we're just pro-integration, right? The balancing of the medication with the holistic lifestyle, everything that we write articles about is, at least what we've seen, the thing that gets people out of these ruts. The other thing that we've written a lot of articles about is make sure you look up the nutrient depletions. Eric, you were talking about, I think it was aspirin and vitamin C before we hopped on here, and not something that I was really even aware of until you had mentioned it just now. It's those things just typically aren't discussed all that frequently, and it's really important. It should ideally be covered in the prescribing process, but they have so many people to get through. Oftentimes it just kind of gets glazed over by no fault of their own. So just make sure you do a little bit of research when you do start new medications, because in addition to the side effects of it just building up in your system, which is a whole other topic, it can cause symptoms and can deplete nutrients that are required to fight off these migraine attacks just on your own. So I think that would be a great piece of advice. In your research for this topic, did you find any other surprises in terms of medication that deplete nutrients or side effects that you didn't assume that would be there?
The one thing that really stood out to me was the SSRIs and then the SNRIs. So SSRIs, selective serotonin reuptake inhibitors. SNRIs is selective norepinephrine and serotonin reuptake inhibitors. And so there's a little caveat there, but what I found was super interesting was that those medications don't work very well in the presence of like B vitamin deficiencies. So if you're somebody who is like not really eating a ton of like red meat or like sources that have a lot of B vitamins inherently in there, you may inherently see just a decrease in the efficiency of your SSRI for whatever reason you're taking it. Now, you may be taking it for depression and anxiety or something along those lines, or commonly those medications are prescribed off label for migraine and migraine-based headaches and migraine-based syndromes. So that was interesting to me. So, and if you're somebody who gets even deeper in the weeds, it's like, well, let's say you have like an MTHFR or like a methylation SNP, something where you can't methylate very well, which is kind of becoming more common knowledge for people, then you might have an issue with even converting and turning on and methylating B vitamins. So it's like this whole cascade of learning about like maybe you're just not a responder to SSRIs because genetically you kind of have a predisposition to not being able to methylate, and then you're not getting enough B vitamins, or let's say you're a vegan or vegetarian and you're not getting enough nutrients that way. And then of course you're vitamin depleted, and now you're trying to take a medication. It's just this interesting cycle that I by no means have enough experience in, but it's interesting to me now to look at and say, well, why is that not more common knowledge? So things like that just continue to surprise me that, I don't know, it just the more patients that I see, the more I get into it, I realize the less we maybe all really know about these things, you know?
Yeah, I'd be really curious. I'll try not to ride the soapbox too hard on this one, but it takes me back to a patient that is one of the more challenging patients I've ever seen. It was, I think she was on, I forget the number, 12 or 15, somewhere between their medications, and it just wrecked her stomach. And she would wake up every morning at about 3 in the morning and vomit. And that was pretty much just her life. She'd get terrible sleep because she'd wake up in the middle of the night and just feel violently ill. And when I asked her questions, it was just one medication after another, and there was no talk about nutrition. And then when you have someone that's so in the weeds with medications that the physical consequences of those medications often take several years of being really good about all the holistic stuff, you can get out of it. It just takes a while to counteract some of those side effects that have accumulated over decades sometimes. And again, this is where the soapbox come in. But I feel like if we did it backwards, like if we just educated everyone on the holistic side first, and there will be a ton of people that just need medication after that, and that's fine.
Mhm.
The
Totally.
the rub is if you had built up those healthy lifestyle habits ahead of time, your body is so much more likely to take that medication and actually use it the way it's intended to. It's when you consistently pile up these medications and then they deplete and they deplete and they deplete and they do what they do. It's so much harder to dig yourself out of that if you had just started initially with all of the lifestyle things. I had a patient come in from Turkey one time for migraines, and she said I think it was Turkey, the way that they advertise supplements is the way they advertise medications here. And I thought that was so strange that we just get bombarded with medication commercials, and there's other countries that advertise supplements with real benefits like they would a medication. So I feel like if we just started to move that direction, which is the whole reason why we're doing this podcast and this newsletter, to get people on board with this lifestyle management first before you get in the weeds with medication, I think it would just be so much more effective for everybody.
Yeah, I agree. And I think that that's a great spot for us to kind of end too, because there's just so much more to the story behind the scenes as well about understanding what med to do and don't do. And like you said, we're not anti-medication, we're just pro-integration, right? It's understanding you structurally, it's looking at you nutritionally, it's understanding how the brain and the nervous system plays a role. And it's a yes and conversation no matter what. It's never just one lane, one provider, or one like approach. Like you really have to approach people in a personalized manner. And it always has been that way. It's just, I think people have been sold a false bill of goods thinking that they can just take one capsule, one tablet, one supplement to, outmaneuver all of their symptoms. And it's never been the case. So I think that the knowledge and the general masses are changing the way that they look at things, but we still have a lot of work to do, clearly. So thank you for joining us today. This is another great episode of the Migraine Mentors minicast. If you are a subscriber to our newsletter, thank you for supporting us. Thank you for being there for us. Thank you for just giving us all the feedback in the comments and the questions you have. If you're not a subscriber, what are you waiting for? We have a subscription link below. It's in the description of the YouTube video. We are adding new subscribers every week, and we're just grateful to be a part of this journey, to be able to share the knowledge and information we have clinically. And hopefully we're helping people along the way and giving them independence and guidance and advice and the education they need to take care of themselves. So once again, thanks for joining us. We'll be here again next week, and I look forward to hearing from you and seeing you. Cool.